am a hemodialysis technician, and one of the things that we do is we take care of patients with chronic kidney failure. We do that by cannulating 2 needles and filtering and cleaning their blood. There are 2 different types of accesses. One is a fistula and one is a graft. With the fistula, you have an artery and vein combined as one. With the graft, it is a synthetic material placed in the patient's body. At one end is the vein connected and the other end is the artery connected. So, what I will be teaching you guys today is how to cannulate a patient. One of the first things that I will be showing you is putting on proper personal protective equipment. We do this with a lab coat. And then we typically wear a face shield, but I just don't have one for today for this demonstration. And then we will be wearing gloves. And we are wearing this stuff to protect ourselves from bloodborne pathogens. We have 4 different sizes of needles. 17 gauge, which is the smallest. We have a 16 gauge, a 15 gauge, and then a 14 gauge. The first step is the look, listen, and feel method. First, we look to see if there's any abnormalities within the arm. The second step is listening to it with a stethoscope. What you're going to be doing with the stethoscope is listening to it to see if there's anything that doesn't pop up to you as being different. What you should be hearing is a thrill and a bruit. The third is feeling it. When you feel it, it should just feel like your regular skin. It shouldn't feel warm. So when we're feeling it, if it doesn't feel warm, then there's typically no sign of an infection. The next step is placing a tourniquet. You're going to place the tourniquet on the patient's arm, tie it tight enough, but not too tight so the access, the fistula, is just up and enough. Next, you're going to feel for your placement for your needle. You're going to take your alcohol swab. You're going to place it where you're going to cannulate your needle, and then you're going to move it into a circular motion, moving from the inside out for 30 seconds. Okay, those 30 seconds have gone by. You're going to let it dry for 10 seconds. You're going to take your needle with your piece of tape. You're going to stretch your skin from side to side, and at a 45-degree angle, you're going to place your needle in. Okay? At this point, you should see a blood flash back. You're going to tape it down. You're going to twist and let your blood draw back, clamp, and then you're going to take an empty 10 cc syringe, twist it on the bottom of the tube, open your clamp, and you're going to pull and push. And what you're feeling right now is you're feeling for if it flows okay. If you don't have any resistance, typically it means it's in the correct placement. You also ask the patient if it feels okay. The patient says it feels okay. So you're going to clamp your line. You're going to take your next piece of tape and you're going to secure your needle. This is for it doesn't pop out while they're dialyzing. And we do that at Fresenius in a butterfly shape. Your next tape is used with a piece of gauze to prevent any type of infection because this is an open wound. Then you're going to continue your steps with your next needle placement, the steps that I just showed you. After that needle is placed correctly, you're going to take off your tourniquet. And that is the way to correctly cannulate a patient. So I'd like to thank my audience. This is Sean, my mother, and my grandma on FaceTime.